Basically, incontinence, and we're talking whether it be bladder or bowel, is the involuntary loss of control. So basically having accidents. It can be things like, I just didn't know it was coming and then suddenly it's there. Or sometimes you get the message, you know what you've got to do, you've got to process it, but by the time you've done that, it's too late. So for some people, they miss the message and have accidents, and for others, they anticipate the message, so they go frequently, so they don't have incontinence as such, but they may be going very frequently, like every hour or something. A normal bladder should probably go and pass urine 4 to 6 times during the day, and maybe once or at the most twice at night. That's a normal functioning bladder. We all tend to take bladder and bowel management for granted until something goes wrong, and certainly with a stroke, we really find out when things go wrong. Some other factors that help, say for carers or for the clients and people with strokes themselves, is just what we call good bladder habits, making sure they drink a reasonable amount of fluid a day, tea, coffee, water, and majority of it being water. Good bowel habits, making sure you use your bowels regularly. When you are drinking, making sure not too much caffeine, not too much fizzy drinks, those sorts of things that are bladder irritants, and they'll tend to make you want to go to the toilet more frequently. I suppose the other thing we have to think of is that at times we don't want to always blame the stroke on any bladder or bowel problems. As a person gets older, as a male gets older, they've got prostate issues, their prostate gets larger as they get older, and that may be part of the contributing to their continence issues. For a woman, they may have a prolapse, so that's an important area to investigate, is that contributing to the continence issue? A person who's got diabetes as well will have continence issues, so we don't always want to blame the stroke for everything. We don't want to assume to blame the stroke for everything. It's an issue that you just don't talk about over afternoon tea, but it is something that's really important to your quality of life. I use that term quality of life a lot, because if you're not managing to look after your bladder or your bowels, you're likely to not be going to social activities. You're likely to do, if you're going to go shopping, you're only going to be shopping very quickly. It really has an impact on quality of life in so many areas. It's really important to know that there is a big range of products out there, much more than you'll get in your local supermarket. There is certainly funding available for people that meet eligibility requirements for the help with the cost of continence products. I think I would say to people that, as a starting point, that understand that it's a problem that is not unusual for people who have had a stroke. There are people out there that understand what they might be going through and are very keen to help them, but it's really important to seek help, no matter how embarrassed you are about this problem. It's just make that call or make that approach to a person, to the health professional, to say, well, look, I've got this problem, what can I do about it?